Chapter 12, Lymphatic and Immune System. Let's discuss the lymphatic system. Let's explore the three lines of defense that our body uses to protect against pathogens. These defenses work together to create a strong, multi-layered immune system. These include physical mechanisms, cellular mechanisms, and humoral mechanism. Physical mechanisms are the body's first line of defense, acting as barriers to prevent pathogens from entering. These include the following. Skin is a tough, protective outer layer. Mucosa is lining of internal cavities that traps and blocks pathogens. Tears and saliva contain enzymes that destroy bacteria. Perspiration contains antimicrobial properties. Nostril hairs filter out harmful particles. Cilia are tiny hair-like structures that sweep away debris. Mucus traps pathogens and prevents them from progressing further. Cellular mechanisms are part of the second line of defense, involving specialized cells that target and destroy harmful invaders. Key players include lymphocytes, such as T cells, attack cancer cells, transplanted cells, and cells infected with viruses or parasites. Natural killer, or NK cells, destroy abnormal cells directly. Humoral mechanisms are part of the third line of defense, involving the production of antibodies which circulate in the bloodstream and bind to pathogens. Once bound, antibodies mark pathogens for destruction by other immune cells, neutralize harmful substances produced by pathogens. Now let's take a closer look at the lymphatic system, which plays a critical role in our body's immune defense and fluid balance. This system has three main components that work together seamlessly: lymphatic capillaries and vessels. Lymphatic capillaries and vessels are found in almost every tissue in the body. These vessels are responsible for collecting excess fluid from tissues and transporting it back into the bloodstream. Think of them as the drainage network of the body, helping maintain fluid balance. The lymphatic cells, tissues, and organs are the factories of the immune system. These structures produce immune cells such as lymphocytes, which defend against pathogens. Lymph nodes act as filters, removing foreign matter from the lymph as it flows through. For example, if you've ever had swollen lymph nodes during an infection, that's your lymphatic system at work. Lymph is a clear, colorless fluid that is similar in composition to blood plasma. It flows through the lymphatic vessels and capillaries, carrying immune cells, nutrients, and waste products. Lymph also plays a vital role in transporting dietary fats from the digestive system to the bloodstream. Let's take a moment to differentiate among similar words in medical terminology. Understanding the suffixes in these terms will help us determine their meanings and applications. The term immune means protected from disease. It's a foundational term in immunology. The suffix "ity" means condition of. Immunity refers to the condition of being protected from disease. The suffix "ize" means to affect in a specific way. Immunize means to affect in a way that provides protection from disease, such as through vaccination. The suffix "logi" means study of. Immunology is the study of protection from disease. The suffix "logis" means one who studies. An immunologist is someone who studies or specializes in the protection from disease. The suffix "ization" refers to the process of affecting in a specific way. Immunization means the process of providing protection from disease, typically through vaccines. Let's break it down. The suffix "lin" means substance. The root globule means globular. Immunoglobulin is a specific protein or antibody that plays a vital role in the immune response. Let's delve into the lymphatic network and the vital role played by its components, including lymph nodes and different types of immune cells. Lymph nodes are key structures in the lymphatic network. They act as filtering stations for lymph, removing harmful substances like bacteria and cancer cells. These nodes are especially concentrated in the neck, axilla, and groin area. Macrophages are immune cells that perform phagocytosis, a process where they engulf and digest pathogens or cellular debris. Think of them as the body's cleanup crew, working tirelessly to keep tissues healthy. T lymphocytes mature in the thymus gland and are critical for cellular immunity. There are four types of T cells. Cytotoxic T cells destroy infected or cancerous cells. Helper T cells activate other immune cells by releasing cytokines. Memory T cells retain information about pathogens for faster responses in the future. Suppressor T cells regulate the immune response to prevent overactivity. B lymphocytes are responsible for the production of antibodies. These antibodies target specific pathogens, marking them for destruction by other immune cells. Null cells are large killer cells that don't rely on antibody recognition. They act independently to target and destroy infected or cancerous cells. Let's focus on the organs of the lymphatic system, which play essential roles in the immunity and overall body defense. These include the spleen, tonsils, adenoids, and the thymus gland, each with unique functions. The spleen is located in the upper left part of the abdominal cavity and contains two types of tissue: white pulp, associated with immune responses; red pulp, involved in filtering the blood. The spleen performs four key functions. Phagocytizes bacteria to protect the body from infection. Initiates immune responses by producing lymphocytes. Hemolyzes old cells, breaking down worn-out erythrocytes. Serves as a reservoir for erythrocytes and thrombocytes. Tonsils are found in the oropharynx. They trap inhaled and ingested bacteria and viruses. They also form lymphocytes and produce antibodies to combat pathogens. Adenoids are located in the nasopharynx. The adenoids function similarly to tonsils. They trap bacteria and viruses and assist in forming lymphocytes and antibodies to bolster immunity. The thymus gland is vital for the development of T cells. It allows for the maturation of T cells, ensuring they are prepared to fight infections. The thymus also secretes hormones that stimulate the production of more T cells, supporting long-term immunity. Let's take a closer look at the importance of correct word differentiation in medical terminology. Accurate differentiation ensures clear communication and avoids errors in patient care. Spleen versus splenectomy. Spleen refers to the organ located in the upper left part of the abdominal cavity. It plays a role in filtering blood, immune function, and recycling red blood cells. Example: the spleen helps the body fight infection. Splenectomy refers to the surgical removal of the spleen. It is performed when the spleen is damaged or diseased. Example: after a splenectomy, the patient needs to take precautions to avoid infections. Tonsil versus tonsillectomy. Tonsil refers to the lymphatic tissue located in the throat, oropharynx, that helps fight infections. Example: swollen tonsils can cause discomfort and difficulty swallowing. Tonsillectomy refers to the surgical removal of the tonsils. It is often performed when tonsils are frequently infected or enlarged. Example: the child had a tonsillectomy to reduce recurrent throat infections. Phagocytic versus phagocytosis. Phagocyte is a noun referring to a cell that is capable of engulfing and digesting harmful particles, such as bacteria or dead cells. Example: phagocytes are part of the immune system's first line of defense. Phagocytic is an adjective meaning pertaining to a phagocyte or its function. Example: the phagocytic activity of these cells helps protect the body from infections. Phagocytosis is a noun describing the process of ingestion and destruction carried out by phagocytes. Example: phagocytosis is critical for removing pathogens from the bloodstream. Let's discuss the immune system. Let's dive into the immune system, a vital network of cells and tissues that protect the body from harm. Understanding how this system functions is key to recognizing its importance in maintaining health. The immune system is made up of specialized cells located in different parts of the body, including the blood, lymph nodes, and tissues. These cells work together to recognize foreign substances like bacteria, viruses, and other harmful invaders and inactivate them before they cause harm. A healthy immune system is essential for defending against pathogens like bacteria and viruses, cancer cells that form within the body, foreign substances introduced from outside the body. Example: when you recover from a cold, that's your immune system at work. When the immune system is weakened or compromised, it can effectively combat pathogens, leading to disease. This may happen due to conditions like HIV/AIDS, cancer, or even prolonged stress. An immunologist is a medical specialist who focuses on the study of the immune system, the treatment of immune-related disorders, and conducting research to better understand immune system diseases and develop therapies. Understanding medical terminology is not just about knowing definitions, it's also about knowing how to use terms correctly in context. Let's explore some key terms and practice using them in sentences. Antigen. Definition: an antigen is a protein molecule that triggers an immune response. Example sentence: when a virus enters the body, its surface antigens are recognized by the immune system, prompting the production of antibodies. Mutation. Definition: a mutation is a change or changes in the chemistry of a gene. Example sentence: certain mutations in DNA can lead to genetic disorders or an increased risk of cancer. Resistance. Definition: resistance refers to the ability of an organism to withstand the effects of an antagonistic agent, such as antibiotics. Example sentence: overuse of antibiotics has led to the development of bacterial resistance, making some infections harder to treat. Let's explore the complex and fascinating world of immunity, focusing on cellular immunity, humoral immunity, and how they defend the body against pathogens. What is cellular immunity? Cellular immunity involves lymphocytes, which directly attack and destroy foreign or abnormal cells in the body. Key players in this process are T cells, specialized lymphocytes that identify and attack infected or abnormal cells. B cells, lymphocytes that assist in antibody production. Macrophages, cells that engulf and digest pathogens and cellular debris. As mentioned in the previous slides, the immune system employs three lines of defense. Physical mechanisms, barriers like skin and mucosa that block pathogens. Cellular mechanisms, direct cellular responses, such as T cells attacking infected cells. Humoral mechanisms, antibody-based immunity, which we'll discuss next. What is humoral immunity? Humoral immunity involves the production of antibodies, also known as immunoglobulins, that bind to antigens and inactivate them. What do antibodies do? Immunoglobulins have specialized roles in defense, including neutralizing antigens, binding to antigens and preventing their movement, causing antigens to become heavy enough to attract phagocytes, which destroy them. These antibodies prepare antigens for destruction, ensuring they are neutralized effectively. How is humoral immunity different? Three key features set humoral immunity apart from the first two lines of defense: specificity, memory, and discrimination. For specificity, humoral immunity is targeted toward a specific pathogen and adapts to each pathogen uniquely. For memory, it has the ability to remember each pathogen it encounters, enabling a faster and stronger defense if the pathogen reappears. For discrimination, humoral immunity learns to recognize self-antigens, or normal body cells, and foreign antigens, or pathogens. When this process fails, the immune system may attack self-antigens, leading to autoimmune diseases. Let's dive into the four classes of immunity, each playing a unique role in protecting the body from disease. By understanding these classes, we can better appreciate how the immune system works to keep us healthy. Passive immunity is short-term immunity provided by external sources. Example: antibodies passed from mother to baby through breast milk. While effective, this form of immunity does not last long, typically fading after a few weeks or months. Active immunity occurs when the body produces its own antibodies in response to exposure to a pathogen or vaccine. This form of immunity usually lasts much longer than passive immunity and can sometimes provide lifelong protection. Example: immunity developed after recovering from chickenpox or receiving the chickenpox vaccine. Over the next 4 slides, we'll explore each class of immunity in greater detail, including specific examples and how they function to protect the body. Let's talk about natural active immunity, an essential process that protects us from diseases. Natural active immunity happens when a person is exposed to a pathogen or disease and their body naturally responds by producing antibodies. This type of immunity occurs without any medical intervention. It's the immune system's natural response to a threat. How does it work? When a pathogen enters the body, the immune system recognizes it as foreign. Specialized cells, like B cells, begin producing antibodies specific to that pathogen. Over time, the immune system develops a memory of the pathogen, allowing it to respond faster and more effectively if exposed to the same pathogen again. For example, if someone contracts chickenpox, their immune system produces antibodies to fight the virus. After recovering, those antibodies remain in the body, providing long-term protection against future infections of chickenpox. Let's explore artificial active immunity, a powerful tool in modern medicine to prevent diseases. Artificial active immunity occurs when a person's immune system produces its own antibodies in response to a vaccination or immunization. The vaccine contains an attenuated, weakened, or killed pathogen, which stimulates the immune system without causing the disease. How does it work? When a vaccine is administered, the immune system recognizes the pathogen's antigens as foreign. This triggers the production of antibodies specific to that pathogen. The immune system also creates memory cells, allowing it to respond quickly and effectively if exposed to the same pathogen in the future. For example, various vaccines are used to prevent the infections of diseases. Elmer vaccine protects against measles, mumps, and rubella. Flu vaccine provides protection against specific strains of the influenza virus. Now let's talk about natural passive immunity, a special type of immunity passed from one person to another. Natural passive immunity occurs when a person receives antibodies that are naturally made in response to a pathogen or disease from another person. This type of immunity is not created by the individual's immune system, but is instead transferred from someone else. How is it transferred? Natural passive immunity is most commonly seen in the relationship between a mother and her child via the placenta or breast milk. During pregnancy, the mother's antibodies cross the placenta to protect the fetus. After birth, the baby continues to receive antibodies through the mother's breast milk. Let's take a closer look at artificial passive immunity, an important method of providing immediate protection against specific threats. Artificial passive immunity occurs when a person receives antibodies that were made by another person or animal. These antibodies are introduced into the body via immune serum or an injection, providing temporary immunity. How does it work? When a person is exposed to a dangerous pathogen or toxin and their immune system doesn't have enough time to respond, pre-made antibodies are administered. These antibodies immediately begin to neutralize the threat, offering rapid protection. For example, immune serum for snake bites. If someone is bitten by a venomous snake, they may receive an antivenom. This serum contains antibodies produced in an animal, such as a horse, that neutralize the venom. Another example is rabies immune globulin. Antibodies are given after exposure to rabies to provide instant protection while the person's immune system develops its own response. Now let's focus on understanding some essential terms by matching their definitions to their meanings. This skill is crucial for mastering medical terminology. Definition: to administer a preparation, such as a vaccine, to generate active immunity. Term: vaccinate. Example: doctors recommend vaccinating children to protect them from diseases like measles and polio. Definition: the process by which cells or other particles adhere to each other and form clumps. Term: agglutination. Example: agglutination occurs when antibodies bind to antigens on red blood cells, causing them to clump together. Definition: a group of proteins that destroy bacteria and other harmful cells by disrupting their membranes. Term: complement. Example: the complement system plays a key role in the body's defense against bacterial infections. Definition: to weaken the ability of an organism to cause disease, often used in the context of vaccines. Term: attenuate. Example: the measles vaccine contains an attenuated virus that triggers an immune response without causing illness. Let's dive into some important medical terms. Not only is it essential to know their meanings, but it's equally important to use them correctly in a sentence. Dormant. Definition: inactive, not currently growing or causing symptoms. Example sentence: the virus remained dormant in the patient's body until their immune system weakened. Incubation. Definition: the period of time or process during which an infection develops in the body. Example sentence: the incubation period for the flu is typically 1 to 4 days before symptoms appear. Opportunistic. Definition: the ability of an organism or pathogen to cause disease in a host with lowered resistance or a weakened immune system. Example sentence: opportunistic infections are common in patients with compromised immune systems, such as those undergoing chemotherapy. Let's discuss two critical medical abbreviations that are often used in healthcare settings. It's important to know their meaning and how to use them correctly. AIDS. Definition: AIDS stands for Acquired Immunodeficiency Syndrome. It's a disease that occurs when the immune system becomes severely compromised, leaving the body vulnerable to infections and illnesses. Example sentence: The patient was diagnosed with AIDS after years of untreated infection with HIV. HIV. Definition. HIV stands for human immunodeficiency virus. It's the virus responsible for causing AIDS by attacking and weakening the immune system over time. Example sentence. HIV testing is a critical step in early detection and treatment to prevent the progression to AIDS. HIV is the virus that causes the disease AIDS. Without proper treatment, HIV can progress to AIDS, but early diagnosis and antiretroviral therapy can help manage the virus and prevent this progression. Let's discuss the disorders of the lymphatic and immune system. Let's take a closer look at some common disorders of the lymphatic system, their causes, and treatments. Lymphoma. Definition. Lymphoma is a cancerous tumor of the lymphatic organs, often found in the lymph nodes of the neck or axilla. Types of lymphoma. Hodgkin lymphoma characterized by the presence of Reed-Sternberg cells. Non-Hodgkin lymphoma occurs more frequently than Hodgkin lymphoma. Treatment options include radiation, chemotherapy, or bone marrow transplant. Tonsillitis. Definition. A viral or bacterial inflammation of the tonsils and adenoids. Symptoms include enlarged and tender lymph nodes under the jaw, sore throat, and difficulty swallowing. Use the figure to illustrate tonsillitis and its effects on the tonsils. Splenomegaly. Definition. The enlargement of the spleen, often due to infections such as hepatitis or mononucleosis, as well as conditions like anemias, Gaucher disease, or lymphomas. Ruptured spleen is common in traumatic injuries to the rib cage or abdomen, such as car accidents. A ruptured spleen requires immediate surgical removal, known as a splenectomy. Lymphedema. Definition. Fluid retention caused by a compromised immune system or resulting from surgery or radiation therapy. Symptoms. Swelling, typically in the arms or legs, due to poor lymphatic drainage. Let's focus on understanding how to differentiate among medical terms with similar roots by identifying their suffixes. The suffix often determines the specific meaning of a word. Lymphoma. Suffix. Oma means tumor or mass. Definition. A tumor or mass of lymph tissue. Example. The patient was diagnosed with lymphoma, which required immediate treatment. Lymphadenectomy. Suffix. Ectomy means removal. Definition. The surgical removal of lymph nodes. Example. The surgeon performed a lymphadenectomy to remove the affected lymph nodes. Lymphadenitis. Suffix. Itis means inflammation. Definition. Inflammation of the lymph nodes. Example, swollen and tender lymph nodes indicated lymphadenitis caused by an infection. Lymphadenopathy. Suffix. Pathy means disease. Definition. Disease of the lymph nodes. Example, lymphadenopathy is often seen in patients with systemic infections or cancer. Lymphangiogram. Suffix. Gram means a record or image. Definition. A radiographic image of lymph vessels taken after the injection of contrast material. Example. The doctor ordered a lymphangiogram to evaluate the lymphatic system for blockages. Let's explore hypersensitivity and its related conditions, which are key concepts in understanding immune system responses. Hypersensitivity. Definition. Hypersensitivity is an excessive immune response to an antigen that would normally be tolerated by the body. Examples. Allergies. Common hypersensitive reactions to harmless substances like pollen or dust. Autoimmune disorders. When the immune system attacks the body's own tissues. Alloimmune disorders. reactions against antigens from another individual, such as in organ transplants. Anaphylaxis. Definition: an acute, severe allergic reaction that requires immediate medical attention. Symptoms: swelling, difficulty breathing, rapid heart rate, and a drop in blood pressure. Anaphylactic shock, a life-threatening form of anaphylaxis, can cause organ failure due to the drastic drop in blood pressure. Asthma. Definition: a chronic condition triggered by allergens, leading to airway inflammation and difficulty breathing. Symptoms: wheezing, coughing, chest tightness, and shortness of breath. Common triggers: pollen, pedander, dust mites, and mold. Now let's explore how the immune system sometimes works against the body or struggles to function properly in certain conditions. Autoimmune disorders. Definition: autoimmune disorders occur when the immune system reacts to a self-antigen, producing antibodies that attack the body's own tissues. Examples of autoimmune disorders. Let's brainstorm together. Can you name some autoimmune disorders? Examples include lupus erythematosus, multiple sclerosis or MS, rheumatoid arthritis or RA, psoriasis. Immunodeficiency disorders. Definition: immunodeficiency disorders occur when the immune system's ability to fight infections is weakened or absent. There are various mechanisms: congenital, present at birth; acquired, developed later, such as through diseases like HIV/AIDS; drug-induced. For example, corticosteroids can suppress immune function. Alloimmunity disorders. Definition: alloimmunity occurs when the immune system reacts to antigens from a member of the same species. Examples include hemolytic disease of the newborn, or HDN, which occurs when a Rh-negative mother's antibodies attack her Rh-positive baby's red blood cells. Transplant immunity. Definition: transplant immunity refers to the immune system's response to a transplanted organ or tissue, recognizing it as foreign. The body identifies the transplanted tissue as non-self due to differing human leukocyte antigen markers. Examples include acute rejection or chronic rejection. Acute rejection happens days to weeks after the transplant when T cells attack the transplanted tissue. Chronic rejection occurs over months or years as the immune system slowly damages the transplanted organ. All right, let's talk about organ transplantation and how the immune system plays a crucial role. Did you know that the biggest challenge with transplants is getting the recipient's immune system to accept the new organ or tissue? Let's break it down. When we transplant an organ or tissue from one person to another, it's called an allograft. This term refers to tissue from another individual of the same species, like one human donating to another. Now, here's the issue. The recipient's immune system can recognize this new organ as foreign. And what does the immune system do when it finds something foreign? It attacks. Both cellular and humoral mechanisms can cause rejection. It's like the body saying, hey, this doesn't belong here, let's get rid of it. All right, let's break down a few terms that share the root immune but mean very different things. It's important to understand these distinctions, especially when discussing how the immune system functions or malfunctions. The common root is immune. Alloimmune. Definition: an immune response directed toward a transplant. Example: when a patient's body rejects a transplanted kidney, that's an alloimmune response. Autoimmune. Definition: an immune response directed toward the body's own antigens. Example: rheumatoid arthritis is an autoimmune disorder where the immune system mistakenly attacks the joints. Immunodeficiency. Definition: the failure of the immune system to react to pathogens. Example, HIV causes immunodeficiency, making patients more susceptible to infections. Immunosuppression. Definition: the ability of an agent, like medication, to suppress the immune system. Example, after an organ transplant, immunosuppressive drugs are used to prevent rejection by the immune system. Let's dive into viruses, the smallest of all microorganisms, and discuss some types that affect both children and adults. These tiny organisms can cause a range of illnesses, from mild colds to severe respiratory syndromes. We have influenza types A and B. These viruses are responsible for seasonal flu epidemics. How are they spread? Through respiratory droplets, like when someone sneezes or coughs near you. Symptoms include fever, chills, body aches, and fatigue. Vaccines are available to help prevent severe cases. We also have coronaviruses. Coronaviruses are a family of viruses that can cause illnesses ranging from mild colds to more severe conditions. For example, SARS, or severe acute respiratory syndrome, is caused by a type of coronavirus. Let's explore the nature of the human immunodeficiency virus, or HIV, and how it progresses to acquired immunodeficiency syndrome, or AIDS, a critical topic in understanding immune system function and failure. What is HIV? HIV stands for Human Immunodeficiency Virus. It's a retrovirus, which means it has a unique ability to replicate its RNA into the DNA of host cells. Think of this as the virus hijacking the host cells, turning them into HIV factories that churn out more virus. HIV specifically attacks T lymphocytes, the cells responsible for fighting off infections. By doing so, it weakens the body's defenses, leaving it vulnerable to infections. HIV is the virus that causes AIDS. AIDS, or acquired immunodeficiency syndrome, is the advanced stage of HIV infection. At this stage, the immune system becomes so weakened that it can no longer defend against infections or diseases. Over time, HIV depletes the T lymphocytes, specifically the CD4 cells, which are key to coordinating the immune response. As the immune system weakens, it becomes unable to combat opportunistic infections, illnesses caused by bacteria, viruses, or fungi that wouldn't normally harm a healthy person. Examples include tuberculosis, pneumonia, and fungal infections like candidiasis. Now let's delve deeper into HIV, where it's found in the body, how it's transmitted, and the opportunistic infections it can lead to when the immune system is weakened. Where is HIV found? HIV is present in various bodily fluids, including blood, semen, vaginal secretions, saliva, tears, breast milk. While HIV is present in all these fluids, not all of them pose a high risk of transmission. We'll talk more about transmission shortly. When HIV weakens the immune system, the body becomes vulnerable to opportunistic infections that wouldn't normally harm a healthy person. Examples include cytomegalovirus, or CMV, a viral infection that can cause blindness and organ damage. Kaposi sarcoma, a type of cancer that forms dark lesions on the skin. Toxoplasmosis, a parasitic infection that can affect the brain. Pneumocystis carinii pneumonia, or PCP, a severe fungal lung infection. Herpes simplex virus, or HSV, recurring outbreaks of painful sores. Candida albicans, a fungal infection often causing oral or genital thrush. Tuberculosis, or TB, a bacterial infection that primarily affects the lungs. Let's use the figure to highlight the skin lesions caused by Kaposi sarcoma, which are a hallmark opportunistic infection in advanced AIDS. How is HIV transmitted? HIV is transmitted when bodily fluids containing the virus come into direct contact with a mucous membrane, damaged tissue, or are injected directly into the bloodstream. Common modes of transmission include unprotected sexual contact, sharing needles or syringes for drug use, from mother to child during pregnancy, childbirth, or breastfeeding, accidental needle sticks in healthcare settings, blood transfusions. It's crucial to remember that HIV is not spread through casual contact, such as hugging, shaking hands, or sharing utensils. Let's discuss the procedures and pharmacology for the lymphatic system. Let's review some essential tests used to diagnose immune responses and detect pathogens. Immunodiagnostic uses antigen antibody reactions to detect immune components. Example: antigens detect antibodies and vice versa. ELISA, or enzyme-linked immunosorbent assay, detects antibodies or antigens using enzymes. Common uses is for HIV testing. Agglutination tests detect clumping when antigens and antibodies react. Used in blood typing. Skin and blood tests measure IgE antibodies for allergies. Skin tests show redness, while blood tests measure antibody levels. Viral tests detect viral genetic material as well as viral proteins. Let's talk about treatments for managing immune and lymphatic system conditions. These therapies range from medical interventions to pharmacological approaches. Lymphatic therapy involves a variety of approaches, including chemotherapy and radiation to target specific conditions. Bone marrow transplantation, often used for blood disorders. Surgical and non-surgical options to address lymphatic issues. Pharmacological measures to support and treat immune conditions. Immunotherapy is designed to boost the body's natural defenses. Types of immunotherapy include monoclonal antibodies, which target specific cells, interferons and interleukins, which enhance immune responses, immunoglobulins, such as human normal immunoglobulin and hyperimmune immunoglobulins, which provide temporary immunity to specific threats. These drugs are used to suppress the immune system and are essential for preventing rejection of transplanted organs, treating autoimmune diseases like rheumatoid arthritis or lupus, managing long-term allergic asthma. Let's move on to two important types of antiviral treatments. HIV drugs. Antiretroviral therapy, or ART, helps control HIV progression, but it is not a cure. Flu medications. Drugs like Tamiflu and Relenza can treat or prevent the flu. Tamiflu works best if taken within 48 hours of symptom onset. Let's break down some key abbreviations related to the immune system. These terms are essential for understanding how the body fights infections and maintains immunity. IG. This stands for immunoglobulin, which is another term for antibodies. IgA. Found in breast milk, tears, saliva, nasal secretions, intestinal juices, bile, and urine. It provides localized protection on mucous membranes. E. Found on the surface of B cells, where it acts as a receptor for antigens. Ig. Present in exocrine secretions along with IgA. Plays a role in allergic reactions and response to parasites. E. Makes up 80% of all antibodies. Found in plasma and tissue fluids, providing long-term immunity. IgM. The first antibody produced in response to food or bacteria.